Hello friends, welcome to a new question. 15-year-old girl has streptococcal pharyngitis 3 weeks ago. She now has low-grade fever, pleuritic chest pain, waxing and waning arthritis, painful subcutaneous nodules. A friction rub is audible in chest radiograph, and she apparently dies of apparent arrhythmia. The heart and pericardial sac is shown here. What is the epicardium finding? So if you see, this finding has dull, shaggy, there is serous pooling and also fibrinous. This all is fibrinous exudate which is seen. See here, what is happening here is the patient has streptococcal pharyngitis which has resulted in pleuritic chest pain, which is nothing but it has progressed to rheumatic fever. In the rheumatic fever, there is a component of pericardium which has been inflamed by the streptococcus antigens, and this resulted in the pericarditis, which is fibrinous pericarditis. So thank you for watching.